Welcome everyone, both in the room and online. If you don't know me, my name is Allison West. I'm an assistant professor here in the Department of Population, Family, and Reproductive Health, and I am very pleased today to introduce our speaker, Dr. Erin Hager. Dr. Hager is an associate professor in our department. She earned her PhD in human nutrition here in the Department of International Health, and then spent over a decade as faculty in the Department of Pediatrics at the University of Maryland School of Medicine, before fortunately returning here in 2022 to our department. Yay! So she is a relatively newly returned faculty member, which is one of the reasons we're so excited to have her give a talk today and share with us all of her important work. And the last thing I'll mention, she is funded by USDA, by NIH, and other local and federal agencies to evaluate the impact of programs and policies to promote healthy eating and physical activity among children with a focus on schools and families. So welcome, Dr. Hager.
Yeah, thank you. And I hear it's 80 degrees outside, so I really appreciate people spending some time with me today. So I am going to tell you a little bit about my interest in food and physical activity policy to start off. And I know there are some students in the room and some online. So my interest really began when I was a student here. So I was fortunate to be able to receive free lunches when I was in high school in the 90s. And then when I came to become a graduate student here at Hopkins, I did a lot of my research papers on school meals. So, you're asked to do a research paper and you kind of pick a topic you really like. And I did a lot of my different class projects on school meals. Both looking at the impact for low-income families, but also the quality. So at the time, there was a lot of talk about the quality of meals not being all that great, which we're going to talk about in a few minutes. And so since then, I've been able to get funded to do a number of different research projects, starting in 2009 with Baltimore City Schools. And then I've been able to get federal foundation and state funding to do lots of other projects we'll talk about today. And I've been able to work with all Maryland local education agencies, which is another name for a school district in Maryland and nationally. So again, I'm going to sprinkle a little bit of that work into my talk today. One thing I've mentioned to a number of you over the years is that I really believe in linking the service that I choose to spend my free time in with my research interests, and that I feel like that makes it a win-win, so that I can bring my expertise to the service and also learn some things along the way. So I've been a member of the Baltimore City School Health Council for a long time. I'm also a member of the Baltimore County Local School Health Council. I was elected the chair of the State School Health Council in 2018, and I still am in that role. I also am the co-chair of CDC, NOPRIN, and PAPRIN School Wellness Working Group. NOPRIN stands for Nutrition, Obesity Policy Research Evaluation Network, which is a mouthful, and PAPRIN is Physical Activity Policy Research Evaluation Network. And I'll mention that throughout my talk today. I skipped over that I'm also a member of the Health and PE Advisory Committee in Maryland. So that committee and the State School Health Council are both state required entities, and so they're written in a state statute. The Health and PE Advisory Committee actually helps to make the health education standards, so that's been a really fun group to be a part of. And then I am hopefully in the next 2 weeks going to be stepping down as a member at large of the Baltimore County Board of Education. But in that role, I got to be on the Policy Review Committee, so I got to see policy being made and contribute to policy. So it's been an interesting way to kind of bring my research and service interests together. So I was joking with my team today that my talk today is going to be a lot like the way I tell a story. It's going to be maybe a little bit all over the place, but I think in the end, it's going to kind of come together just because I wanted to cover a lot. So I hope that it, like in the end, I hope you're like, yeah, that did actually make a lot of sense. So the first part of my talk is going to be on food policies. Second part, it'll be physical activity policies. And as a bit of a spoiler, most of it will be on food policies, and you'll see why when I get to physical activity policies. In each section, I'm going to talk about federal and state policies, focusing on Maryland. And I'll give a little bit of a history, how we transitioned during the pandemic, and then a look towards the future, because there's a lot of things happening on the horizon, particularly in the world of food policy. So kicking right into food policies. So question for the audience and people online, if you want to write into the chat, what are the ways that food is either sold or provided to children at school? So just yell it out if you want. Lunch, breakfast, yep. What else? Vending machines, good. What else? Rewards, right. Giving rewards to kids during the school. Anything else anybody can think of? Parties, celebrations, yes, that's a big one. So I think we covered most of them. So the National School Lunch and Breakfast Program are how we feed kids for lunch and breakfast during the school day. We also have snacks that are sold to kids in vending machines, but also in the cafeteria, other school stores, other places throughout the school day where food is sold to kids. And that falls under a USDA program called, well, it's not called this, but we call it Smart Snacks. There's something else called the Fresh Fruit and Vegetable Program that the USDA sponsors that we're not going to talk about today, but it's another way that, that schools do provide fruits and vegetables to kids in the school day. Celebrations and rewards are ways that kids get food. And then there are some after school programs that are sponsored by the USDA that we're also not going to get into. So again, we're going to focus mainly on these three things: meals, snacks, and celebrations and rewards. But first, a brief history. So the first lunch programs really started in the late 1800s, just as an effort within communities, recognizing that kids needed lunch during the school day. And so families would just work together and bring kids meals during the school day. And it was started just kind of creating this structure of school lunch. And so it was informal, but it was the first kind of way that we started seeing school lunches form. It wasn't until 1936 that the federal government created a commodity donation program. So that's, of course, during the Great Depression. So families were unable to provide, acquire food for their children because of issues with the finances, because it was the Great Depression. And so, but also farmers then weren't able to sell their crops because people couldn't afford to buy them. And so there was this issue where the government stepped in, they bought the crops from the farmers and fed it to kids during the school day. They were commodity crops. And so this was the initial kind of federal government version of a school breakfast or school lunch program, which then led to the formalization of a school lunch program, which was through the 1946 School Lunch Act, signed into law by President Truman. And this law included that the lunches had to have minimum nutrition requirements, which they still need to have. They had to be served without cost or reduced cost to children who could not pay for lunch, which we still do. They had to operate on a nonprofit basis, which is still true. They had to use commodities in abundance and commodities donated, again, what we still do. And they had to keep proper receipts, expenditures, submit reports to different agencies. Again, all of this from 1946 is really how a lot of the school lunch programs are still run today. And the last one I wanted to mention was in 1966, President Nixon, through the Child Nutrition Act, added the school breakfast program. So that was when that was initially put into place. So I could have talked for an hour about the history, but I just wanted to give you a brief snapshot and then take you forward to today. So I'm not sure how many people know the term nutrition transition, but it's this concept where there's a shift in dietary consumption and energy expenditure that coincides with other economic, demographic, and epidemiologic changes. And you see the shift occur in conjunction with different diseases and reasons for death in populations. And so in the US, in the first 50 years of the school lunch program, we saw that we were trying to use the school meals programs to prevent conditions related to undernutrition. So we had a major issue with undernutrition in our country. Families were experiencing food insecurity, and we saw a lot of micronutrient deficiencies. But then fast forward to the most recent 30 years, it was really meant to prevent chronic diseases related to overnutrition. So now we're in a bit of a different situation where we see less undernutrition in the US and more diseases related to overnutrition. But at the same time, we still have food insecurity and we still have micronutrient deficiencies. And so this creates a situation where we need to create a meal pattern and foods that we can provide to kids that meet the needs of all of our children. And keep in mind that this meal program, since the beginning, has also been an issue of national security. So this has been said a lot. So we need to make sure that we are raising a generation of children that could fight in a war if needed. And so they need to be healthy. And so this has always been a big focus of a lot of these federal programs is, making sure our children are healthy and moving forward. And that's been a quote that's said by a lot of presidents over the years. And so, we do need to keep that in mind. So the Healthy Hunger Free Kids Act. So this was signed into law 1 year into my first faculty position. It was a really exciting time to be someone who was studying food policy because it really was a landmark nutrition policy. So it passed in 2010. In 2012, the new nutrition standards for school lunch and breakfast programs went into effect. In 2014, the standards for smart snacks went into effect. 2016, there were new standards for childcare programs, which again, we're not going to talk about today, but I'm happy to talk about if anybody's interested. And then finally in 2017, local wellness policy implementation guidelines went into effect. And this is what impacts those celebrations and rewards that we mentioned earlier. So we'll circle back to that. But those 3 time points, 2012, 2014, and 2017 are what I'm going to dive into. So these are the nutrition standards. I love this slide because it's just so interesting to see how it was before and how it is now. And for some of you students in the room, I bet you were in school in 2012 and probably came to, we always say students walked into school in September and were like, why does my pizza taste funny? And so the difference was that it had a whole grain crust and a low sodium sauce and a low fat cheese. And it was a really different pizza. Also, it took a little while for the food industry to kind of catch up to the guidelines. So the initial products weren't quite as tasty as they are today, but we're getting there. But one of the more interesting standards, I think, is just the top line with calories. So before the Healthy Hunger Free Kids Act, there was only a minimum number of calories. There was no maximum. And you could feed a kindergartner the same meal you fed a 12th grader. And there was nothing guiding anything in between. And so with the Healthy Hunger Free Kids Act, there are now minimum and maximum standards, and they're based on grade. So you have elementary standards, middle school standards, and high school standards. We have more fruits and vegetables. There's a diversity of vegetables. So you have to have these weekly standards with dark green, red, orange, legumes, and starchy vegetables. And you can go through and see the others. I want to point out milk. So one of the changes with the Healthy Hunger Free Kids Act was that to have flavored milk, it had to be fat-free, or you could have 1% unflavored. Before, fat and flavor didn't matter. Whatever you wanted was up for grabs. And there were all grains had to be whole grain rich, and there were 3 tiers of sodium levels that you had to hit. So one thing about the Healthy Hunger Free Kids Act, we were so excited when it passed. It was such a landmark legislation, but it was, and I'm glad David's here today because he could probably tell a million stories, but me being very naive, it became so politicized. And it really, from what I've read, school food was not that politicized in the past. It was really kind of, we need to feed kids, they need to eat healthy foods, end of story. But instead, this really became very political. And so within the first couple of years of the Healthy Hunger Free Kids Act meal pattern changes, there was some pullback. So you could have 1% flavored milk. We stopped at those 3 tiers of sodium. We stopped at the first tier. The whole grain requirement got pulled back. So they really pulled back, not on a lot of things, but on some things, just to kind of manipulate the meal pattern a bit. But one of the things that scared me the most as a budding researcher was that a lot of the arguments were challenging the dietary guidelines. So meal patterns are set on the dietary guidelines. Dietary guidelines are set in science. And so if the food industry is saying, do we really think sodium is bad for you? Then that starts to get really scary because the science shows that it's not good for you to eat a lot of sodium. But if there starts to have this dialogue about, well, is that science really that strong? And so that really can undermine so many of our meal programs in our country. And so that's kind of the conversation that was happening. So then when the Trump administration took place, they introduced more pullbacks. So additional pullbacks to the school meal program. Interestingly, the Center for Science and the Public Interest filed a lawsuit against these pullbacks, and they won. So those didn't go into place. And if you notice the date on this article, it was April of 2020. So of course that was right when the COVID pandemic hit. So this didn't get a ton of attention, and it kind of fizzled out. So those pullbacks kind of never really went into play. So having said that, it became very political, but we also know that it's working, and we're seeing more and more studies show that these meal pattern changes were really impactful. So one of the first papers that showed an impact was in 2016, where they looked before and after the meal implementation, and they found an improvement in nutrition quality, decreased energy density of food served by students, and importantly, no difference in meal participation, because this was a big talking point that kids were throwing away meals, they weren't eating them, it was contributing to food waste. Turns out we've always had an issue with food waste in school meal programs. That wasn't new, but when you focus on it after the fact, then it seems like it's a new problem. But before and after, there was really no difference in meal participation and meal waste. So with my colleague, Lindsay Turner at Boise State, through this NOPRIN working group that I mentioned, we were invited to write an editorial on this, really highlighting the importance of this particular paper in the context of these pullbacks or proposed rollbacks of of the meal standards, and it's got a lot of press, and it really highlighted how important these changes were. Since then, there was a study that looked at NHANES data over time that showed diet quality of meals consumed at lunch during the school week among kids who were eating school meals did improve before and after the Healthy Hunger Free Kids Act, and that the findings were stronger for children from low-income families. So a lot of people have been saying for a long time that this is an equitable policy, that we're really able to target populations that may have been consuming unhealthy diets before and increase the quality of the diets. And so this is one of the papers that really supported that. And then just a few weeks ago, a paper from the ECHO cohort came out showing that there was a decrease in BMI-Z scores following the Healthy Hunger Free Kids Act standards. And they did an interrupted time series analysis. And this paper is interesting to me because I used to cite a modeling paper that predicted that this would happen. And now we have a paper that shows that it did happen. So it's always fun when a modeling paper shows what they predicted actually comes true. So that paper was written by Steve Gortmaker's group. There are definitely challenges to school meal programs. So before the pandemic, we saw that even among, so the black bars are the children who would receive free or reduced price meals, that we do not see full participation. And importantly, participation decreases with age group. So elementary schools participate the most, goes down in middle schools, and then goes down even further for high school students. So just providing a free meal doesn't mean that kids were going to participate. There's so many reasons for the school level, the student level, for why this might be. And so one thing that the USDA is interested in is kind of tackling those barriers to participation and trying to work on increasing participation in school meals. So now I'm going to talk about smart snacks. I told you it's going to all come together in the end. So smart snacks is that other piece of legislation from the Healthy Hunger Free Kids Act that addressed foods sold to children during the school day. So any food sold in schools must meet one of these requirements: be whole grain rich, have the first ingredient as a fruit, vegetable, dairy product, or food, or be a combination food that contains at least a quarter cup of fruit or vegetable. And it has to meet all the other requirements on the right. So when these standards were introduced, a lot of us were thinking, this is going to be great. We're going to see really healthy snacks for kids. And this is, I told my friends when kids go to school next year, the snacks are going to be so healthy. And immediately people were saying, I don't know about this because my kids are being sold flaming hot Cheetos. And how is this meeting smart snack standards? And my kids are being sold nacho cheese Doritos, and I'm not so sure about this. And, and I could go on, but this concept of copycat snacks went into play. So these snacks do meet smart snack standards. So they meet those standards that were introduced. Their labeling is slightly different. The colors are different. There's some things that are different. They are not sold in stores. They're only sold to schools. And so, on one hand, they are meeting the standards. So they're a healthier version of a flaming hot Dorito, or flaming hot Cheeto, but they do, it's all about brand loyalty and trying to hook the kids into that. And so it's a very controversial area of snacks, but it is where we are right now. There may be some changes coming with new nutrition standards introduced, but this was a big concern. We have seen some research showing that smart snacks have been impactful. There was a study recently looking at beverages specifically that were sold under the smart snacks regulations. And basically they showed that there was compliance for the most part in schools, and that when you are in a school that has low compliance, you're more likely to choose the non-compliant foods. So really making sure that all the foods are compliant is the best way to ensure uptake of the healthier versions of foods. And then another study that found that when smart snacks went into effect, fewer students were eating snacks and they started eating lunch, which we know is definitely healthy. There are vegetables, there are whole grains, there are all the things that we want them to eat. And so overall, using 24-hour recall data, they were able to show that there was a decrease in sugar consumption during the day that was not compensated for later in the day. So again, this was an overall win for just modifying the snacks in schools that could have a deficit of sugar throughout the day that could impact health in the long term. So what does Maryland look like when it comes to school meals and snacks? So we abide by the USDA school meal programs, but we have enhanced our smart snacks standards. So we call them Maryland Nutrition Standards for all foods sold in schools, which essentially is smart snacks Plus, we do not allow diet or caffeinated beverages. So under Smart Snacks, you can sell diet beverages and diet energy drinks. And so in Maryland, our legislators did not like that, and they immediately put into place a law that does not allow those things to be sold in schools. In addition, each local education agency has a food service director who oversees school meals and smart snacks that are sold through the cafeteria. School level managers and staff then report to that food service director. And just like everywhere else around the country, our teams need to stay within budget, feed hundreds of children, and meet all of these guidelines. So during the pandemic, we talked a lot about school food heroes. I would say they've been heroes for decades and decades. These are people who do a lot of really hard work, often low wage workers. And they're meeting a lot of really strict guidelines to make sure they feed our kids healthy foods. So one more thing I'll mention about meals before the pandemic is a project that we worked on with the State Department of Education called Project Select. This was conducted again pre-pandemic, where we were looking to help increase meal participation for those middle school students. So the ones where we started to see that decline in participation. And so we used 3 approaches: student engagement, we addressed lunchroom environment, and we helped to train the cafeteria workers in different types of culinary training through these culinary boot camps. And in this intervention, it was a small pilot intervention that did have a control group. We did see that we were able to mitigate the decline in lunch participation that was observed in the control schools. So control schools saw a decline, the intervention schools didn't increase, but they didn't decrease in lunch participation. And we did see an increase in vegetable selection and consumption using procurement records and plate waste studies. So, so we were excited about the promise of this intervention, and we began to promote the report and work with other school districts in expanding this effort in January of 2020. So of course, a lot of those efforts came to a halt. We are revisiting a lot of those things now that people are starting to get ready to kind of readapt some of the pre-pandemic strategies that fell off to the wayside. Okay, so still talking about pre-pandemic, we're going to move on to celebrations and rewards. So this one is regulated a little bit differently. So it is under the USDA, but it's under something called a local wellness policy. I love talking about local wellness policies, by the way. So wellness policies were put into place in 2004 by the federal government. They had to be in school districts by 2006. So this is a little longer ago than the Healthy Hunger Free Kids Act. There are written school district documents, and the implementation of a wellness policy takes place at a district or school level. The idea is that the implementation of these policies that address opportunities for healthy eating and physical activity during the school day will lead to enhanced opportunities for health and wellness for children, and then improve child health and likely academic outcomes. And so again, these are really focused on healthy eating and physical activity opportunities. And you can write in that you will abide by the USDA standards. That's pretty common language. You will abide by the smart snack standards, but you can also go above and beyond with those things, and you can address additional behaviors as well. So as part of the Healthy Hunger Free Kids Act, the federal government addressed the fact that all school districts had these policies, but very few were implementing them. So there was a bit of a disconnect between having a policy and implementing a policy. And so with this Healthy Hunger Free Kids Act and local wellness policy final rule that went into place in 2017, the content of the wellness policy was addressed to be expanded and include things like addressing celebrations and rewards. So that was one of the places that the USDA was not involved with before. And now through wellness policies, they're looking to at least have school districts decide what they're going to do about celebrations and rewards. They're not saying what they have to do, but that has to be addressed in your wellness policy. It included other changes as well. And the last bullet on this list is something called a triennial assessment. So every 3 years, the school district needs to report to the state, who reports to the USDA, how every single school in their district is implementing their wellness policy. So 100% of their schools. And so if you look at the date of July 2017, that meant the first triennial assessment was due in June of 2020. So 100% of the schools had to comply. So again, these are the language said it had to address foods provided but not sold. Some sample language from actual Maryland wellness policies would be something like principals will work with teachers and school organizations to minimize the use of candy and other foods as a reward system for students. So that would be allowed by the USDA, but clearly it's very weak language. So it's going to check the box, but it doesn't show that there's any real teeth behind the policy. Strong language would be something like use of food as a reward or punishment is prohibited. And so again, implementation of this, of how well they were doing with all these things didn't go into place until June of 2020, which meant that in the spring of 2020, schools were starting to think about it, right? And they were like, oh, now we have to actually make these changes and see what's happening. And of course, that's when the pandemic hit. So everything got delayed with that as well. One thing that we've worked with the State Department of Ed and the State Department of Health since 2012 is to help schools with the implementation of their wellness policies. And so we did this through a project we call the Maryland Wellness Policies and Practices Project. And in that we collect data from schools. We have a survey that goes out to every school in Maryland. Typically the school principal completes the survey, but it could be some other wellness leader. From the data we collect, we provide tailored district level feedback, which for the triennial assessment could actually be used for the triennial assessment. That was why it was kind of a win-win for the districts. From that, we would then provide technical assistance, resources, and support, which would ideally lead to district level wellness initiatives, which would ideally lead to school level wellness initiatives, which we would then capture when we collected data again in the following year. And so in this process, we had 4 waves of data collections. We have a lot of data on wellness policy implementation. And one of the really cool things about this project is it was essentially a natural experiment where we were looking to find out what the impact of those, the Healthy Hunger Free Kids Act wellness policy implementation mandates were on wellness policy practices at schools. However, again, it was disrupted by the pandemic. So this was our last data just to show you what Maryland schools are doing with respect to rewards and celebrations. So as far as restricting food given as a reward, only about 1/3 of schools are engaging in that practice. So it did go up. It was a statistically significant increase from 2016 to 2017 to 2018, 2019, but it's still only 38%. And then again, districts get to decide how they'll address celebrations. So these are the 3 most common ways they address them in their policy. Prohibiting celebrations is less commonly used. About 16% just said no food celebrations. About half limited the number. So this is something where they'll say, we'll do 5 a year, we'll do 1 a month, something like that, so that you aren't, you have 30 kids in your class, that's 30 birthday parties. Then you add in about 5 holidays, you got, 35 cupcakes in a year easily. And so that can really add up. And so the last one, which is actually what my district did in Baltimore County, is they said that you can have a food celebration, but it has to be Smart Snacks compliant. And so I thought they did a nice job with implementation because they provided examples of things you could bring in that met standards. So, these are just some ideas. So that is the biggest chunk of my talk was the history. Now we're going to get into the changes that have happened and the future of school food policies. So I could probably talk for hours about school or pandemic era feeding practices for schools. We were able to work with the State Department of Ed to do 2 different projects where we evaluated the implementation of school meals in Maryland. But this timeline is just here to kind of show you what happened throughout the pandemic. So the top, you see the 2018-2019 school year. That was the year before the pandemic. There was in-person learning. The school lunch and breakfast program was in place. Everything was normal. The following year in March in Maryland and throughout the country, schools closed due to the COVID-19 pandemic. And we immediately shifted to virtual learning, and the USDA allowed schools to feed children through the summer food service program, which is a summer model. Susan Gross is the summer person. So if you have any interest in learning about summer, she knows everything about summer feeding programs. But the summer food service program does not follow the National School Lunch Program standards. So all those updated standards we were so excited about that I told you about were not followed for SFSP. So and sadly those are the meals that parents saw when kids brought them home, and they would say, I mean, my own children were like, there was a Slim Jim and a juice and a milk. And I was like, oh, that's not what we normally feed the kids during school meals, but it's more of like a snack lunch because it's a summer meal. And so, that was this SFSP. And then it carried on through hybrid learning. And then in the start of the 21-22 school year, we allowed schools to follow the seamless summer option. And the upside of that is there was a higher reimbursement rate, and they followed the National School Lunch Program standards. So that was really exciting. And all throughout the pandemic time, universal meals were given to every kid in the country. So every kid got a free meal. And then at the end of the 22 school year, that ended. So the universal meals ended. And again, I could go on and on about this, but this is all I really wanted to say about pandemic school meals across the country. In Maryland, we did get to work with the State Department of Ed, and we produced 2 reports and a number of publications looking at summer meal service in Maryland. This is just one graph that shows that the orange line are total meals served in Maryland. The blue line are free and reduced price meals served. Once the pandemic hit, they were universally given, so there were no differences in those meals. But we saw a 71% decline in meals served for total meals, 58% decline in free and reduced price meals. And this makes sense. Kids aren't in school. It's really hard to feed a kid when they're not directly in front of you, right? And they did a really, really good job of trying to meet the needs of the kids, but it was just really hard when you're talking about a community model. One interesting thing that has gotten a fair amount of attention is that once schools were reopened in person during the 21-22 school year, and meals were universally offered for free, we were basically at the same rate as we were pre-pandemic. So the lines are similar. So we thought that this line would be way up here where kids would be getting lunch because it was free. We did see a number of issues around supply chain concerns and quality that suffered because of the supply chain issues. So others are studying this in other states as well. And so we're just taking a deeper dive, and we have a lot of qualitative data with this project as well. So what does the future of school food policy look like? Like I said, there's this great de-implementation that's happening across the country with so many different federal programs, including school meals. So in Maryland, we were one of the states that experienced de-implementation this year. What is happening at the state level are these healthy school meal for all state policies. And so this is a graph put out by FRAC, and you can see the the blue states are ones that have adapted universal meals for all children. So I know it's kind of blurry and hard to see. Blue states have universal meals. The orange and yellow have temporary universal meals. So they're for a few years, they put them into place. Green states are considering universal meal legislation. And New Mexico will be a blue state on their next map when they update it, because they just adapted them last week. So, so more hopefully will be added to this map as the momentum is building around healthy school meals for all. Very importantly, there are new proposed nutrition standards for school meals. So the comment period has been extended to May 10th. If you're interested in commenting, I strongly encourage you to do so. The 2 big things in my point of view that are included, one of which I've been waiting for I think 10 years now, is added sugar. So when I think it was the Affordable Care Act, when the initial idea came about to make on your nutrition facts label, it now says added sugar. I don't know how many of you have noticed that, but there were so many delays and lawsuits and you name it. With the dairy industry didn't like it, and lots of different industries didn't like this added sugar component. But by having added sugar on the nutrition facts label, we can regulate added sugar in breakfast foods. So sugar alone is challenging because you have fruit sugar and you have milk sugar. And so it becomes, well, sugar, really sugar. Added sugar is something we can regulate. So that is included. One thing that's a little bit concerning from my colleagues who are on the ground are the sodium regulations, because they're pretty strong. And the concern is that the food isn't going to taste very good if there's basically no sodium allowed. And so that one I'm a little more nervous about, but I'm very excited about the added sugar aspect. There is a new dietary guidelines committee that has been formed. There will be new dietary guidelines in 2025, and that is what dictates what's in the school meals. So if we're really thinking about it and thinking ahead, making sure that there's good science out there that can support decisions that are made by our dietary guidelines committee, which is all scientists. And of course, the Farm Bill and Child Nutrition Reauthorization. Those are two more big things that are coming. And so lots and lots of things are coming down the road with food policies. Last thing I'll mention with federal policies is that the USDA is investing a ton of money in school food right now. They just released these USDA School Food System Transformation Challenge grants, which is $50 million that they're pumping into addressing the quality of school meals through procurement, local food access, training for staff, all kinds of things. And they announced the awards on March 23rd. I am part of a project with Lindsay Turner at Boise State that's called Project Scales. We're going to be focusing mostly on urban school districts, rural food districts, not urban, throughout the country for the first 2 years of the project. It's a 5-year initiative, and so we'll get started this summer. And it's going to be a really great opportunity to see how to best help school districts create really tasty and desirable school meals for kids. In Maryland specifically, we are experiencing a huge CEP expansion. So CEP is a community eligibility provision, which provides meals for free to kids who just for every child in a school that's located in an area that is considered a low-income community. So it doesn't have to be individual eligibility, it can be community level eligibility. And so what they've done in Maryland is we've added Medicaid as an eligibility criteria, which by doing that, huge increase in the number of schools that are now eligible for CEP. Given that in Baltimore County, our number of schools that were eligible just skyrocketed. And so that was one of the things that I really wanted to accomplish as a school board member, and Medicaid addition did it for us because the district decided to just do it because it made sense. Now that there more schools were eligible. So 100% of schools in Baltimore County will get universal meals next year because of this change, and that's happening around the state of Maryland, not just in Baltimore County. Our Healthy School Meals for All legislation did not go past crossover day in the legislative session. So we're hopeful for next year, but it's probably not going to happen unless something drastic happens in Maryland this year. But the one bill you can keep an eye on is the expansion of Maryland Meals for Achievement, which is our free breakfast program. So we do have a program where we provide free breakfast to kids in a lot of schools in Maryland, and this would expand the reach of that program. So you can keep an eye on that one. And then lastly, wellness policy implementation. I mentioned that the triennial assessment would have been due in June of 2020. That didn't happen. They let them submit it in 2021. As you can imagine, that might also not have been the best quality triennial assessment out there, just given everything else that schools were dealing with. So the next assessment is going to be due next year. So this is a really great opportunity to kind of regroup, look at wellness policies, reevaluate where schools are. As the State School Health Council, we're hosting regional meetings in the next couple of weeks, and one of our topics has to do with the triennial assessment. So we're going to be kind of jumpstarting the school districts to think about this because it will be due next year. And we are also working with MSDE to identify ways that we can support the triennial assessment, given that our Maryland Wellness Policies and Practices project ended because of the pandemic, if there's a way to kind of reboot some of those efforts to help school districts in the future. All right, that's everything about school food policy. I told you that would be the bulk of the talk. So in the remaining time, which isn't going to be a lot, we'll talk about physical activity policies. So same question, what ways are children physically active during the school day? Recess, gym. Anything else? After school activities? Yes, sports, active transportation, walking to and from school. Any other during the school day things you can think of?
Changing classes.
Changing classes is a way to kind of walk around. We don't talk about that enough. So I did this, asked my husband this question last night, and he said that one too. So I think we need to address that more. So PE class, recess, physical activity breaks are really popular. So these are time like brain breaks and just getting kids up during the school day. I used to teach a 3-hour class, and I made my students do brain breaks because the science is there. We know that it cuts the blood flowing, and so we would do the hokey pokey or whatever I could find online, and it was always a little fun and silly. Integrated physical activity is when you jump up and down when you're doing math problems or doing something that aligns with the lesson plan specifically. And then active transportation would be more of a before and after school, same with sports and other activities. So the reason I'm not going to talk at length about PE is there is no federal PE policy, no federal physical activity policy. There's nothing exists on the books. There are standards, and standards are developed by SHAPE America, which stands for Society for Health and Physical Educators. These are the standards. They're very general, but also SHAPE America is an absolutely fantastic organization, but they're not a federal organization. They have no regulatory ability. They're a professional organization. And so these are the standards that, that people use, but again, it's not done by any sort of federal agency. I'm not sure how many of you are familiar with the NCI class data. If not, this is a great resource. It stands for Classification of Laws Associated with School Students, and it's only for nutrition and physical education laws, but it's free data if you're interested in looking at policy data. This, and they call these maps. It kind of looks like a map. If you kind of blur your eyes a little bit, it kind of resembles a map. And so in this case, this is physical education time requirements. So a 0 means that there is no state level PE law. So you can see that most states have something on the books around PE. One is PE is only recommended, and the most popular number is 2. Which is where Maryland falls as well, which is where there is a PE requirement, but it's unspecified. So it doesn't discuss time or anything else. And I'll show you what Maryland's law says in a minute. So that's really where most of the states are, that there's this kind of generic, not very specific PE requirement. Recess, there's no state requirement in most states. So again, there's no federal requirement, and the 0 means no state requirement as well in law. Maryland is one of those states where we have no state level recess requirement. We did a paper recently that's under review with one of our Paprin working group fellows, and it looked at prevalence estimates of elementary school recess practices in the US. This was a study that was conducted through March of 2020. It ended a little bit early, but there was a lot of data that was collected. And just getting an idea of kind of where we stand now, because a lot of the prevalence estimate data was from over a decade ago. And she found that most elementary schools do report providing at least 20 minutes a day of daily recess, with close to 60% providing at least 30 minutes. However, about half of schools are still withholding recess as a punishment, which is definitely not a best practice. We don't want schools to do this for so many reasons. You know, a lot of times the kids that are misbehaving need recess, as we all know. And so there's so many reasons why this is not an ideal practice. And yet we still see it in about half of the schools. And interestingly, withholding recess was also more prevalent among schools that were serving lower income communities. And so the idea that, you know, again, this practice, trying to figure out ways to provide strategies that this can be prevented in the future. One physical activity angle that's been very popular is something called a CSPAP, or a comprehensive school physical activity program. And the idea is that all those things we mentioned at the beginning could be put together into a way for a kid to get 60 minutes of moderate to vigorous physical activity during the school day. So if every kid could get that recommended amount of activity during the school day, then anything they do outside of school is a bonus. And so that would be the ideal situation. And it can be achieved by incorporating these different angles, including activity breaks, active recess, integrated physical activity. This is a model that's promoted by the CDC, lots of different professional organizations. In fact, we just submitted a CDC grant, and one of the requirements was that you train schools in completing a CSPAP. So, so it is something that there's a big focus on doing, since there is not a lot of policy behind this. However, all of these components of a CSPAP could be written into your local wellness policy. So it's something that you could do to ensure that at least at the local level, there are policies around activity breaks, integrated activity, and things like that. So how does Maryland look? Again, we have a state policy that I think was rated a number 2 on that map. It says that students in K-8 must take an annual PE program meeting national standards. So it's pretty generic. High school students must earn a half a credit for graduation. So that's really all it says in state law around PE. As far as our Maryland Wellness Policies and Practices Project data is concerned, the last round of data that we collected found that over 65% of schools reported that they were not withholding recess as a punishment. This is always a hard one because it's kind of a double negative. So every time I try to describe it, it doesn't, to make sure I say it the right way. So in Maryland, the rates are higher than we see nationally. 40% reporting integrating physical activity during the classroom activities. 46% report providing resources to support physical activity breaks, and 90% report providing recess in elementary schools, and 33% report recess in middle schools. And one of our state school health council webinars actually was on middle school recess a few years ago. And it got a lot of attention because it's just a missed opportunity and another way that kids need that outlet and they're not getting it anymore in middle school. We were just talking about how middle schoolers are often kids, you know, and they still need to run around. And so a school principal actually talked on that webinar about how behavior problems went down. So I know I'm running out of time here. So just a little bit on pandemic era physical education and physical activity. There wasn't much of it. So we know that physical activity declined dramatically during the pandemic. When schools did reopen, there were these COVID-19 prevention policies in place that really limited the ability for kids to be active, to engage in quality PE between the distancing and the masking and all things that were needed, but it did really limit physical activity and physical education. We had a paper again with a Paprin fellow who was one of our former postdocs who did a national survey of PE teachers during the pandemic, and not surprisingly found that they did not feel that they were very effective or that the children were engaging during asynchronous learning or hybrid learning. And even when kids returned to school, that their engagement was not what it was pre-pandemic. And we honed in on resources that they received to adapt to providing PE in an asynchronous format, and there were just not very many resources available to them. So this paper was published last year. So as far as the future of physical activity policies goes, Shape America is updating their standards. So if that's something you're interested in, they just ended a round of feedback 2 days ago, but there will be more opportunities for feedback and draft standards are published. In Maryland, there was not a single physical education or physical activity bill submitted this session. There have been every year, Delegate Walker from Prince George's County has submitted a recess and a recess bill, a physical activity bill. He's tried something every year and it's never passed. So we can talk about why at length, but it's just then this year nothing was submitted. So I told you PE would be short. So that was all I had to say about the physical activity policies. So in summary, so it's been about 80 years since the National School Lunch Act. There have been a lot of changes. The pre-pandemic focus was really on changing the quality of the meals through the Healthy Hunger Free Kids Act meal changes. A big focus now is getting access to kids through universal meals. But at the same time, we're also still focusing on the quality of meals through these different USDA efforts. There remain no federal physical activity or education policies with limited state policies, but a lot of this can be written into a local wellness policy at the district level. So really focusing on what you can do at your district level could be an answer to a lot of the limitations of these state and federal policies. And there are lots of initiatives in place in Maryland to promote health in schools, and there are lots of ways to get involved. And here are some. So you can comment on federal policies and standards that are under consideration, follow the Dietary Guidelines Committee, look at, check in on all those things. There's a lot of times there's model language, so you don't even have to write, come up with all your language on your own. If you would like to join the CDC, NOPRN, or PAPRN or School Wellness Working Group or the Maryland State School Health Council, I'll have the websites at the end. You can just get on the listserv and join as you wish. If you are a community member or a parent or loved one of a school-age child, there's so much you can do. You can read your local wellness policy, find out about your district's local school health council and consider joining. If your school has a wellness team, you can ask to join that. And if they don't, you can start one and we can help you with that if you're interested. That's something that we do in our group a lot. Our website is marylandschoolwellness.org, where we have a lot of different measures and things available. And we do have a lot of data analysis and writing opportunities if folks are interested in getting involved. And my last slide is just to show you that I think a lot about diet and physical activity, but there are lots of areas of school wellness that we did not touch on today. What we really use when we think about school health and the state school health council and local school health councils is this WISC model. So the whole school, whole child, whole community model. And what I talked about today are 2 of the 10 components. So there's a lot more out there that should be considered. And I know that Dr. Marshall's class, for example, touches on all of these areas. And so there are lots of folks around here who focus on multiple areas of the WISC model. And so this, just to point out my awesome team, a lot of whom are here today, who of course do so much of this work. And then the oranges are my, I have 2 kids with January birthdays and the Smart Snacks celebrations rule. Clementines are in season in January. And so we drew emoji faces on the clementines, and that was our Smart Snack celebration in lieu of cupcakes that met the standard and still allowed the kids to celebrate. So, and all the websites are there. And that is it. Yes.
Thank you, Erin. There's so many different areas you touched on. Politicization, of course, is critical. I wonder if you would comment on the shift in the local school districts in terms of representation between various ethnic and racial groups. And it's been my view over the last number of years that I've seen the increased number of low-income children as opposed to average income children. The dynamics are shifting with respect to the PTA groups and other local boosters for healthy school meals, so that this has resulted in a increasing target for the school lunch program, school breakfast program, wellness program on the part of Congress, because more children are in special schools, particularly high income private schools. This changes the dynamics, and the politicization is continuing to go forward.
Absolutely. We actually did a paper for the Maryland Wellness Policies and Practices project that was a mixed methods paper looking at barriers and enablers for different wellness efforts in schools. And that was, whenever I talk about mixed methods research, it's always one of my examples of why it's so important to get that qualitative context, because one of the potential barriers or enablers was parents, and the quantitative data wasn't that interesting. But then when we did interviews with school districts, it was in part because parents could be helpful and they could not be helpful. And they really, it's kind of 2 sides of the coin. So you have parents who, if they're passionate about health and wellness, can be huge advocates for opportunities for healthy eating and physical activity in schools. Or you can have a contingency that feels like you're being the cupcake police and my kid deserves a cupcake. And the cupcake wars were dramatic right before the pandemic. I can think of a few counties that were, nervous to have community dialogue because there's huge groups of people would be coming screaming, demanding cupcakes for their kids during the school day. And that's something they felt very strongly about. And so, I think you're right that the parent involvement, I think probably with most things, the school is probably not just health and wellness, right? But can be helpful or harmful. And the lack of parent involvement can also, play a significant role if you're not getting that community voice in the school district. Perhaps.
What do you think will be the next step to get physical activity on the agenda? I know that with school meals, you have a whole industry, you have the whole agriculture industry in the United States that benefits from it. So there's a lot of impetus to kind of have there be this investment and continue to renew kind of investment over time. But we don't really have that for physical activity, and that's potentially just as important of a piece of this puzzle. So what do you think are the next steps there?
Personal opinion, not research based, is I feel like the Department of Defense could get involved. If you're thinking about what federal agency could really be at the table to say we need physical activity in schools. Not that I think this all should be like about the military or anything, but at the same time, that would be a group. Because what other group and the federal government, I mean, certainly the CDC wants to promote physical activity in schools, but what group has the power behind it to say we need physical activity in schools? And so that I feel like is just a missing part of the conversation. We used to have the US presidential fitness test. Now it's called FitnessGram, but that was all kind of linked to that idea. But without the physical activity to back it up, why are we measuring fitness in schools? The kids aren't even getting PE. They're not getting recess. It's frustrating to the PE teachers because it's not like they're failing the kids. They don't have the time to work with them. And so, it's this, I feel like we need a federal agency to say this is a priority. And then because nobody's really speaking up and saying it's a priority in my view. It shouldn't be a controversial. We know kids need to be active, right? It's part of so many aspects of mental health and physical health and well-being. So it is interesting that it isn't talked about as much as school meals.
What policies do you think should be on the sort of local, state, or federal agenda
That aren't currently? I would have said added sugar a year ago because that has been something that I've been following the nutrition facts labels so closely because I like that would have been the next step, would be the school meals. And similarly with universal meals, that was something that we were fighting for, and I never imagined we'd even be here if it weren't for the pandemic. I think that was really something that let us having families realize how great it was to have their kids have these meals at school, opened up a lot of eyes. And I think that really helped this conversation. Not that it was a good thing to have a pandemic, but I think that it really helped move the conversation along. Yeah, those have been my two kind of soapboxes for a while. So not to think of a third soapbox. So I will keep thinking and certainly get back to you on that.
Hi, Erin. Thank you so much for your presentation. So I'm a mother of a 5-year-old who goes to pre-K, and I'm vegetarian. I'm raising him vegetarian, and it's funny. I look at the menu every day and I see grilled cheese for like vegetarians. But what I did want to say is I am a Tanzanian, and my father came. He went to school during the socialist era, during when Nyerere came in charge, and essentially what they had to do is they had to go to school and they had to do farming as part of their curriculum, you know. And so I've been hearing your talk, and more I've just been thinking about that, because even us, when we were in school in Tanzania, we had like a project that we had to do as part of social studies, where we had our own farm patch and we had to grow our food, and then we had to like do all the farming. And so that integrated both the food as well as the physical activity within the school. And I know this is hard to do in the US because it's such a big country and there are so many different political opinions, but it's just something that I thought of while you were talking. So I thought I would comment on that.
No, it's actually something I think that's certainly happening. There are very, very involved 4-H programs in schools across the country. I always call myself a city mouse because I grew up in Baltimore, and when I see a school that has its very own cornfield, I'm always amazed by it because it's such an interesting thing that I never grew up having. But there are many schools that do have an agricultural program within a high school. And then certainly school gardens have become more and more popular, and that's a way that there are curriculum that have been developed to help children learn about growing food and be involved in that process. Baltimore City Schools has a fantastic farm. If you've ever not been there, we're talking about doing a volunteer day with our team. If any, I could expand it to the department if anyone would be interested. You can go and see the Great Kids Farm. It's actually located in Catonsville. Even though it belongs to the city schools, it's really a neat thing to visit and help out with. So I think those opportunities exist, but it does, with so many things, take someone to be a champion to lead the effort and kind of get it rolling. And if you have not been introduced to our extension agents at the land grant University of Maryland, which is University of Maryland College Park, we have a lot of partners there, and I'm happy to make connections if anybody needs an extension partner for some of that work. Phil?
That's always a great presentation, and you made a lot of recommendations. The school district sort of every 3 or 5 years revise and finalize their wellness policies. If you had to pick one of the things that would be, again, this is your opinion, it's not a randomized trial about it, that you think would be most useful to be focusing on, is there one of the things you covered, or even just some of the other things you've worked on that you think would have the biggest impact given where schools are now, or at least have a chance of getting implemented?
I'm going through my head. So there are a number of state requirements that have not made it into a lot of policies that need to be there. So the things that are kind of extra, I would really focus on the physical activity aspects of things, because the language from the federal government around physical activity and wellness policies is fairly weak. So there aren't a lot of requirements. So the more that you can do in the policy to specify recess time, PE time, even if there's a way for, even if it's weak language around physical activity breaks or integrated activity, I think that could be something that at least then once it's in policy, it's in policy. So I know there's a lot of pushback to take it out of policy and put it in the regulations, which you get a new superintendent, they can flip around the regulations. So I'm a big believer in putting what you want in the policy, and that has more staying power. And I know Baltimore City's working on their wellness policy again now in time for the triennial assessment. So there will be more opportunities to get more things like that in there. But yeah, off the top of my head, I'd say that the physical activity component of the policy is usually pretty weak and could be strengthened.
Thank you.
I know some folks have to get to class, but this is fantastic. Thank you so much.
Thank you all so much for listening. Sylvia.